video. So in today's video, I'm going to talk about community nursing in the UK. Hello everyone, and welcome back to my channel. I hope you're all doing well. Okay, so in today's video, it's by popular request. I've had so many questions concerning this particular topic. That's why I'm making this video. So in today's video, I'm going to talk about community nursing in the UK. I have lots of people ask me questions. They go like, oh, we are public health nurses back at home, or we are community health nurses back at home, but we don't know if we can come to the UK to work as community nurses. The answer here is yes. You can come from overseas to work as a community health nurse or a district nurse in the UK. Most people don't shed more light about this particular topic because basically everybody doing YouTube is talking about coming to the UK to work as a bedside nurse, coming to work on the wards. People don't really talk about community nursing, like, okay, migrating from your country to come and work as a community nurse. They only talk about coming to work bedside. So today I'm going to shed more light on community nursing in the United Kingdom. So if you're a community nurse back in your home country, or you're a public health nurse back in your home country, you can come here to work as a community nurse. You don't need to go onto the wards if you don't want to. If you want a non-bedside job and you want to continue working in public health or in the community, you can come to the United Kingdom to work in the community field. So somebody would ask me, who's a community nurse? So a community nurse or community nurses are nurses who visit people in their homes and residential care homes. Yeah, they render care services to patients and also provide support to family members of patients. So basically your patients are going to be the elderly, people who are terminally ill, people who have recently been discharged from hospitals and they need follow-ups, and also people who have mental or physical disabilities. Yeah, these are the group of patients you'll be dealing with, but basically it's going to be elderly people. So to become a community nurse in the UK, it's no different process. It is just the normal process that's coming in as a registered general nurse, an adult nurse. Yeah, you need to choose adult nurse when you are doing your NMC registration. Yeah, so it's the same process, right? CBT, everything. Pass your IELTS and your OSCE and you come here. All you need is the PIN from the NMC to show that, okay, you are a registered member of the NMC UK. Then you can start looking for jobs. So it's nothing different. The criteria is not different from coming to the UK as a community nurse. You just need to do your whole process, write your exams and everything, and get your PIN. Once you get your PIN, you can go online and search for community nursing jobs, but you need to be specific that you are an overseas applicant. Yeah, if you're applying from overseas, you need to look for jobs in community area that shows that, okay, you're applying as an overseas applicant, because most of the jobs are sometimes limited to people being in the UK, but there are other jobs that are open for overseas applicants and they even give sponsorship. So you need to be particular and specific in your search for jobs regarding community. So it's nothing different. It's like the normal route everybody uses. So I have most people tell me they don't like bedside. We don't want to work bedside. If you don't want to work bedside, there are other options. You don't necessarily have to come to work in the hospital or on the clinic or something. You can choose to work in the community, public health, go home visiting and all that. And I think it's more flexible because we that work on the wards, we work most of the time 12-hour shifts. Yeah, but people in community, from what I know, most people start at 9 a.m. and finish off at 5 p.m. So it's quite flexible. If you have family or you have kids and you don't feel so comfortable leaving your house very early, because we working on the wards, I leave home at 6 and shift starts at 7. So if you don't feel so, and I go sometimes around 8 or 7:30. So it depends. If you don't want to go through all that and all the ward stuff, you want to work in the community, you could go in there, it's flexible and it's nice from what I have heard. Who knows, maybe someday I might want to go community. Yeah, so let's go to the job description of what community nurses do in the United Kingdom. It's a whole lot anyways. So as you can see, the first one is recording physiological observations competency, which is the normal vital signs we all do: blood pressure measurement, temperature measurement, assessment of circulation of peripheral pulses, blood glucose monitoring, respiratory measurement, pulse oximetry. Yeah. We have venipuncture. Venipuncture is the taking of blood samples for lab investigation. So you are going to take bloods from your patients and send them to GP or whichever hospital that is in your location you are working as a community nurse. Obtaining a midstream specimen of urine, obtaining a catheter specimen of urine, taking a pathology swab, administration of transdermal patches, administration of nebulizers, administration of creams and ointments, steroids, barrier creams, and skin preparations, administration of eye drops, administration of pressurized metered dose inhalers, administration of bowel care related suppositories, administration of bowel care related NMS, administration of oral tablets, administration of medication via enteral feeding tubes, which is the PEG feed and all that, administration of intramuscular injections, administration of subcutaneous injections, pressure ulcer awareness and prevention strategies, simple wound care, which is the removal of sutures, clips, post-traumatic, surgical, moisture lesion, burn, pressure ulcer management, chronic leg ulceration, diabetic foot care or ulceration, negative pressure wound therapy, vac pump, cavity wound, fungating wound. When it comes to the nutrition aspect, enteral feeding via a feeding pump, setup and disconnection, which is the PEG feed. Most of the patients are on PEG feed at home, so you would start the process of it, leave it on, and then come discontinue it after the feed is done. Change of water in balloon, gastrotomy, PEG site care, full nursing assessment, right plans of care following assessment of nursing need and evaluation of caregiving, nutritional assessment, example must. Then we take patients' weight and everything to be sure they are getting the right nutrition and they are the correct weight they need to be. Pressure risk assessment tools, use a recognized pain assessment score, continence assessment, female urethra recatheterization, installation of catheter maintenance solution, male urethra catheterization, suprapubic catheterization, administration of palliative care medication, continuous subcutaneous infusion, syringe driver setup, renewal and removal, management of ascitic drainage, PIC, mid, Hickman line dressing, discontinuation of chemo pump, recognition of sepsis, responding to anaphylaxis reaction, responding to hypoglycemias, and that's it. So like this is a checklist just to name a couple of things that is likely you as a community nurse would be doing. It is not every one of them you would be doing though. It depends on whichever trust organization you are working with and the set of patients you are going to get. So don't worry if you don't have the competencies. They are going to train you, just like when any new nurse goes onto the ward, you are put on supernumerary or preceptorship, you are going to be trained and all that. It's same in the community. If you don't know how to put in a catheter or any of these things, whoever you're going to be shadowing or going to be working with is also going to teach you until you are competent and you feel confident to perform any of these procedures. So yeah, that's just like basically some of the things you'll be doing as a community health nurse or community nurse or district nurse, which I find quite interesting, because I was thinking the job scope is going to be a bit limited, because back in my country, community nurses don't do most of these things. Yeah, they do home visiting and basically health promotion and prevention, but not catheterization and maybe giving IV antibiotics and insulin and all that. No, but here it seems like it's a much more broader scope of work. So that's it about it. It's not all about bedside nursing. If you want to go into community and you don't want to work bedside, you can go directly to community. If you have been a public health nurse or community health nurse back in your country and you want to come to the UK but you do not want to work on the wards, you can equally look for something that suits what you used to do before coming here, if that is what you want. But one other thing I can say is that I'd advise you get a driver's license if you want to go into community, because you'll be moving from one patient to the other, and sometimes the residents don't live in the same neighborhood. You have to find your own means of getting there. So being able to drive or having a driver's license before getting here would be like enormous benefit to you, the nurse. I'm not even joking, because if you don't have a license or you do not drive, imagine having to catch buses or trains or taxis or whichever means of transport you are going to be using before you get to one patient, do what you want to do, go to the other. Sometimes you'd have to walk, and we all know the weather in the UK is something else. It could be snowing, the next minute it's raining, the next minute it's sunny again, it's cloudy, it's windy. It's unpredictable. We can get like 4 different sort of things in a day. So I'd advise, if you have your own driver's license, you have your own car, don't bother about the fuel aspect, because you are going to be paid for fuel. You're not going to use your own money to fuel your car to visit patients and all that. So that one shouldn't be much of a problem. And they earn the same salary as all of us working on the wards. I mean, like band 5. If you're band 5, you're band 5. It's still the same salary. There's nothing like maybe somebody working on the ward earns more than a community nurse, or a community nurse earns more than. It's still the same thing. So if you have the passion for public health, you like prevention, health promotion, promoting wellness and all that, I mean, like, you can go for it, and you don't need to have like any sort of like ward experience. I know people who are newly qualified nurses straight from school who went into community. That's for people who schooled in the UK, though I don't know if overseas newly qualified nurses can go straight into community. That one I can't tell, but I know people who have just left uni straight without any experience, no background of experience, and they went straight into community, and they are thriving and they like it over there. So that's it. I feel like it's a part of nursing people don't really talk about. It's always about general nursing and working on the wards and all that. So if you have interest in relating with people and their families, and you don't want to necessarily be in a hospital care setting, I think you can go in for community nursing. It's something that you might find interesting and you would like. So to the community health nurses who have been in my DMs and all that, I hope you are satisfied now. You can come to the United Kingdom and work as a community nurse. The thing is that most people complain they don't really see community job applications for overseas nurses. One thing you can also do is that you can equally come on the normal route as an adult nurse wanting to work in a hospital or care home or whatever. Once you get in here, you can start applying for community jobs if you want, and I can bet you there are lots of vacancies for people already in the United Kingdom. I have seen a lot myself. So if you feel maybe going direct as a community nurse, you're not getting the sponsorship or the applications as you want, you can come as you want to work on the wards or in a clinical setting. Once you get here and you work for a short period of time, you can then resign and move into the community and do what you want to do. Don't feel limited because you just want to work in the community and you're not seeing probably sponsorships or applications for overseas applicants. You feel like you are tied down to your country, you cannot move. You can equally come in as a nurse working in a clinical setting, then later you divert and switch to what you find joy and happiness in. It's all about being happy in what you are doing. So if you feel community is what is going to make you happy, go for it. So this is just a little bit about community nursing in the United Kingdom. Yeah, so thank you for your love and support. Please leave a comment and leave a like on my video. Don't forget to share my videos, like and subscribe to my videos. All right, catch you in my next video. Bye bye.